Welcome everyone to Tools for Comprehensive Prevention Planning, the Capacity Assessment, brought to you by the California Department of Social Services, Strategies TA, and Population Change Institute. I want to bring your attention to some instructions for Zoom. I know we're all experts by now, but just wanted to share a few reminders. You will be able to unmute your microphone later on, but we do ask that you please mute yourself just to reduce any background noise. You can stop or start a video. We will be having some breakout sessions. We'll talk about that in just a minute. So we do want you to share your camera if you're able to do that. If you have questions, you want to comment on anything, you want to share any information, you can use the chat function, which you can see is just a little, it looks like a message bubble. You can click to turn on or off captions. We do have live captions available for anyone that requires that, as well as American Sign Language. You can select a breakout room to join. Well, actually, we will actually assign you to breakout rooms. We're having 2 breakouts today. And if you wanted to use the reactions, we encourage that. So please feel free to share those if you would like. A few housekeeping items. This presentation is being recorded and will be uploaded to the Strategies TA YouTube channel in a few days. So please check that out and please share that with others if you think they might be of interest. Again, just a reminder to mute your microphone during this meeting to avoid any background noise. If you have questions, you can use the chat box. And also we have a brief survey that is going to be dropped into the chat at the end of the session. So we just ask that you please complete that. If you're not able to do it at the end of the session today, we will email it to you so you can do that later. American Sign Language and translation services, as I mentioned before, will be available in the main room only. If you require video relay services for the breakout rooms, we will drop the link in the chat so that you may be able to access that. So I will go ahead and pass this over to Sarah.
Thanks, Lydia. Good morning, everyone. So nice to be here. Nice to have you join us for our webinar today. So we wanted to just share briefly about the partners who make this possible. And that, of course, is our funder, the California Department of Social Services. And you can see the mission of CDSS here: to serve, aid, and protect needy and vulnerable children and adults in ways that strengthen and preserve families, encourage personal responsibility, and foster independence. And also Strategies Technical Assistance. I'll quickly introduce myself. My name is Sarah Lacroix, and I'm the Director for Strategies TA through Children's Bureau of Southern California. And we help to support both the Central Valley and Southern California regions of our great state. And in a minute, I will introduce my counterpart, Lola Cornish, who's with the Child Abuse Prevention Center supporting the Northern California counties. So briefly, Strategies TA, we support county child welfare systems and child abuse prevention councils, or CAPCs, to build comprehensive and integrated networks of care through individualized technical assistance, focused on building statewide long-term solutions that are research-driven, trauma-informed, and community-focused. Next slide, please. All right, so we would love to now bring all the voices in this webinar today into the room. So please put in the chat your name, your organization or county department, and your county. And how are you showing up today? Meaning, as best to your abilities using a feeling-based word, what is alive for you today? So we'd ask that you please put that in the chat so you can let us know. I see them coming in. Excellent. I'll just share that I have a lot of excitement this morning. That would be what's alive for me right now. Happy that we're getting this going. I'm really thankful that we've had this great partnership with CDSS and that we can start to get some support to counties to help with the capacity assessment tool, as well as building those capacities. So thanks so much. Next slide, please. And I'm going to introduce my wonderful counterpart, Lola Cornish. Lola helps to support, is with the Child Abuse Prevention Center and helps to support the Northern California counties. And Strategies TA is a partnership both between CAP Center and Children's Bureau. So Lola, take it away.
Thanks, Sarah. So we have some intentions that we want to share with you for this training. The first is try to be fully present. I know a lot of folks had yesterday off or had Monday, which is always a fun day to be in the office. But for me, it's Tuesday. It's Monday on Tuesday. So time can be precious and we want you to get the most out of this that you possibly can. We will have 2 breakout sessions where you'll have a chance to participate. If you choose to participate, please do so as fully as you can. If you're not able to participate for any reason, when the room is assigned to you, please just decline it. And we want everyone to think about how the capacity assessment can really be used to deepen the conversation about the comprehensive prevention planning process. Next slide, please. So in the spirit of being fully present, we wanted to take 1 minute to do a centering activity. So we'll have a 1-minute meditation. So if you'll just sit back, relax, and listen.
And we'll take a few moments to calm your mind and body. Soften your face, your neck, and shoulders. Do your best to fully let go. And turn your attention to the breath. The calming breath, the soothing breath. Take long, slow breaths, full and deep. Breathing in, I am calm. Breathing out, I'm at peace. Close your eyes.
Oops, sorry, I think we got about half a minute in, and now we're going to pass it off to our trainer for the day, which is Patricia Bowie from the Population Change Institute. Hi, Pat.
Hi, everyone. Good morning, everyone. Thanks for having me here, actually. I wanted to have a chance to have the opportunity to talk to you all about tools, right? Tools for the planning process. And today's session is thinking about capacities and thinking about the best way to use the capacity assessment tool put out and forward for you to assist you in your prevention planning. So before I did that, I wanted to actually lay a little bit of groundwork and say, you know, as we get into doing all this planning and all it takes to bring everybody together, all it takes in terms of the timelines and fulfilling all the tasks that we need to do to get this plan together, to take a step back and think fundamentally, what is it all about? And why are we actually doing this? And fundamentally, what this is about is asking for large-scale systems change. So that's a little bit different than the language that's in the capacity assessment tool. So I wanted to actually just make sure we were grounded in this is what we're actually building capacities for. And we know a lot about systems change, right? So just starting from the beginning, the systems definition, a very simple one laid out by Donella Meadows, is, if we could click through, a system is a group of interacting, interrelated, and interdependent components that form a complex and a unified whole. So that's the simplest form. It's not the system like child welfare. It's kind of breaking this down more in terms of scientifically, what do we know and understand about systems? The system's overall purpose or goal is achieved through the actions and the interactions of the components or the separate elements. Now, fundamentally, what is being asked for Families First is to actually take a step back and shift your systems goal, which is a powerful force for systems change, right? If we change our primary goal, right, for thinking about, it's not just about child safety, right, or child abuse and neglect even, it's thinking about child well-being and mitigating child abuse and neglect. It forces us to reconfigure and think about the different ways we relate to the different components or the different people within our counties, the different systems, the different programs that we have. So it's a huge opportunity to think about systems in a different way. Next slide. Now, what we actually understand, we are currently living in a system, right? Whether it's, and this system is perfectly designed to get the results that it gets. That isn't our aspiration of what we are hoping the system would achieve, but the data actually does tell us that that system design is designed to get these results, right? So we can look at it from, and this is why even thinking about, you know, it's child welfare data, how well kids are doing. Are all kids doing equally? No, we're actually having different results for disparity in results for different populations of kids. That shows us and tells us that system is designed in a particular way that's driving those results. Thus, we actually can change how we design that system and thinking about the levers, right, and the influence of changes we can make in that. And fundamentally, if we don't change it all, even if we call it something different, we all show up in the same spaces, we tend to have the same agenda, we tend to have the same conversation, nothing is actually going to change. So thinking about shifting, what would it then mean? And what are the capacities and how will you go about trying to make this work that will make a difference? So for the next slide, so to change the system's results, we need to change the system's design, right? And where we actually choose to focus our change really does matter. So I just put this iceberg up there. I think many people have probably actually even seen this. Most of probably what I'm saying isn't even new. It's just a reminder. This is what we're about, because we get lost in the details of this comprehensive prevention plan and all of the elements to kind of step back and say, what is it fundamentally trying to get us to do? It's trying to get us to think, right, differently about our system design and act and behave different. So, you know, in this, right, what we tend to actually get focused on are the events, the things that we see. And so we actually have to develop that capacity. Do we have to react to that? Of course we do, right? But that can't be all that we do. We actually have to then think about, but why is this occurring? What are the patterns and trends? And if we actually understand patterns and trends, can we begin to anticipate and think about what is our capacity to anticipate? What would that design look like? But fundamentally, if we can actually begin to anticipate, we can actually then think about, are there other levered points that we hadn't actually even anticipated? What could a whole new design actually look like? What are the opportunities of new partners, new reconfigurations of the way that we partner and put programs together, the way that we think about all of those things? That's really when we think about a different design, a whole different approach. But fundamentally, the most powerful thing in terms of change is to really get underneath, to recognize what are the assumptions, the beliefs, values that actually built and sustain the system as it is. So what would actually, how do we actually have a change in the way and the assumptions that we're making and the possible mindsets that we have going in, right? So, and lastly, for the next slide, right, it's remembering that these key points, right? The system is more than the sum of its parts. If we only focus on certain a program, introducing a program, that's a part, right? It's actually how programs interrelate, how people are actually intersecting and interconnecting with these various programs, right? How do programs and how are these interconnections made in human systems? It's through the flow of information. So how do we make information more visible? How do we make it more transparent what is actually happening? It's reminding ourselves that the least obvious part of the system is its function or purpose, right? And that it's the most crucial determinant of the system's behavior, right? So, and I don't mean that in an aspirational way, right? Like if we recognize that these are the results we're getting, that actually really is the function and purpose. And how do we actually shift that? We shift that by concentrating on a system structure. It's the source of the system's behavior, that the system's behavior reveals itself as a series of events over time. So we can't understand how a system's works by doing kind of a snapshot view, right? So it brings us back to thinking about capacities. Capacities aren't a one and done. Capacities aren't, oh, we have it. We don't have to think about that. Capacities are practices that we consistently build, monitor, and try to sustain and support. So finally, last slide. The system includes us, right? So fundamentally, when we think about capacities, we're talking about our individual capacities, our organizational capacities, right? If we don't change, the system's changes are harder to achieve, and they generally do not achieve the desired level of impact that we are hoping for. So that's just our kind of setting us up and kind of getting us thinking about what we're talking about today. So fundamentally, right, we at this point, we're going to kind of take a step back from this. We can take the slide deck or the PowerPoint off. And we want to consider the collective capacity for system change, right? So where are we with that, right? So today's session is considering those capacities necessary to do our collective work, and then explore how would we actually even know that that capacity is present, right? The capacity, remember, it's not about the why we're doing it or what we actually did, but it's how we're going about trying to achieve, right, our goals, and how are we organizing ourselves, right, to truly create change. All right, so for this, what we need to focus on and think about, what are the actions, what are the behaviors, or what are the practices that would indicate you have an existing capacity. So this is going to be our first breakout session. So what I want you to do is think about a positive, successful experience you've had in doing collective or collaborative work. In a small group, I want you to tell that story, 2 to 3 minutes, right? Just what that experience was, give people, kind of a taste of, here's what we were trying to do, here's who it was, whatever that story was. The other folks in your breakout are just listening, right? They're not asking questions, they're not interrupting, they're listening to you just tell your story, 2 to 3 minutes. What they then are going to do after you finish your story is put in the chat, what are the themes that they heard, like not the detail of what made your experience successful, but what actually were some of the behaviors or actions, right? What were some of the underlying elements that they believed really actually contributed to your success? So we're going to go around and each person will have a chance to tell their story, capturing those in the theme, and then see what are the themes across your various stories. Right? And those are what we're going to bring back and have a conversation about in the larger group. All right. So with that in mind, and folks will come in, the TA strategies, TA team will come in if you have questions, if any of that wasn't clear. They'll pop in to assist you, but we're going to take that time right now to break out and have you share, introduce yourself and share a story with one another.
Do you want to share how much time we have, or 30 minutes? I have, but I'm just wondering.
Yeah. I mean, you have plenty of time to tell your story. Here, let me.
Back, everyone. Welcome back.
Welcome back. All right. So welcome back, everybody. So I want to just take a moment to name the exercise that we just did, right? It's part of a facilitative process called Appreciative Inquiry, right? Very modified version, but just a way of bringing people together, because in every group, something has actually gone right? So the focus, So the focus and the key to appreciative inquiry, what we were just doing, is to identify what actually do we know about this? What do we actually, and what experience have we had that have actually been positive and successful? And how do we make those more explicit in order for us to do more of that? We tend to spend, the idea of appreciative inquiry is by focusing on what we do know works and doing more of it, we actually in turn do less of what doesn't work, instead of spending time always just trying to diagnose why it didn't work versus actually trying to magnify and manifest the things that are actually working. And why I wanted to start with that is we've spent, and I know you've spent a lot of time on collaborative processes. And this is the intention of the comprehensive prevention plan. It's thinking about a collective collaborative process to actually have improved outcomes for kids and families. So now I want to just open up and just ask you to offer what were some of the key practices or behaviors your group identified as instrumental, right, in collective success? Things that came up, what are some of the themes? Melody?
Don't look at me like that, Troy. He smiled as soon as I put my hand up. Because I can always be counted on to talk.
Well, we'll take it. Thanks, Melody.
We had a really good conversation. We heard about 3 amazing programs or collaborative efforts, and things that came up. A couple of things that came up were making sure that we talk a lot about in these groups and different collaborative groups about reflecting the voice of the community, parents with lived experience. But when it comes down to it, when we're actually talking and doing the planning, the folks that we're planning on behalf of don't often actually get their input meaningfully applied. And we need to approach the tables and approach those conversations really humbly, and a way that, like, we may have an idea and that turns out not to be what the community wants or needs. And we need to be able to kind of put our pride and our preconceived ideas to the side to say, okay, we can switch gears, like, let's get creative. And we also talked about how important it was to have both the visionary thinkers at the table, but the implementers at the table too, because we'll have lots and lots of big, beautiful ideas. And then it's like, all right, who's going to do this? And then we don't actually make a lot of progress because we get stuck in our big ideas and not a lot of action. But I really appreciated my group, and I thought we had a great conversation.
Excellent. Thanks, Melody. And Cynthia actually put a great synopsis in the chat from Breakout 1, right? The goal was vaccinations, client-centered, a transparent process, weekly meetings with the nonprofits and government leaders, continuous communication, right? Open with sharing data, which led to healthy and difficult conversations, building trust. Power dynamics can cloud decision-making, but the process was able to bring the organizations together to accomplish the agreed upon goal, right? Having that shared goal, having that open communication, having a mechanism to actually share that information so that people, trust isn't a fixed state. Trust happens over time as people are exposed to each other and their ideas and the testing of those ideas. Those are critical capacities, right? Thank you, Cynthia. Other groups, other thoughts, what came up? What were the themes in your stories? What do we know about this already?
I took a bunch of notes for group 6, so I can just very quickly, definitely what came up for us was communication, building relationships, being stronger together, that was accepted part of the group, but also patience, persistence. Also, we are here to help. Like we're, thinking about the other parties and why are they at the table? Not necessarily just that idea of what's in it for me, but also how is what we're going to do going to make your work more efficient, more effective, and better, because everybody's so busy. So that's a really important piece. And my group, please feel free to share.
I really appreciate that one, Barb, right? It's acknowledging we all live within our organizational structures, our own systems, if you will, and those have some set goals and boundaries or parameters in which I have to operate. So it being transparent about those allows other folks to organize around that, right? So it's not a why, blaming of why can't you be what you're not. It's how do we work with what we have? How do we make the most of that? But that requires communication, right? And that shared perspective and transparency, right? And that can be challenging, right? So it's thinking about capacity is building the structures and the processes that enable that to happen. Again, this isn't a capacity that you get to check. These aren't capacities you just check off and say, oh, we got it now. We don't have to look at it anymore. These are practices that you have to nurture, right? And build over time. Other thoughts about that? Thanks, Jeanette, in the chat, right? It was patience, open-mindedness, making sure the right people are involved, helping people process the change, and changing priorities when needed. Absolutely. Right?
I'll just jump in and add for my group, very similar themes, but it was very interesting how each of the stories kind of took on the same pathway, starting out with what I'll call the major reach out, right? They figured out what the problem or the challenge was. Who do we reach out to? So that's that whole conversation, which we were able to then relate back to our prevention work. We had a small conversation about that. Who needs to be at the table, right, for the problem solving? Do we have the right people? Do we have the right capacity to get this work done? We also talked about role clarity, right? Once you get to the table, what's your role going to be, in solving it? And the outcomes that were very positive had to do with both sustainability, meaning they started something that started to last, and the fact that we all had a commonality that things started with no money. The money came later, right? We started the work with no money. So that's very similar to where we are in many cases. So those three things really stood out.
Interesting. Other comments, experiences?
I don't know if you mentioned room 8, they had put someone put here, inclusiveness, collaboration, communication, building on what has worked in the past, strengths, consider what will work in the county, the size of the county, assets and resources, taking time for each step of the implementation process, from identification of the problem, assessing, making sure all structures are put into place. So a lot of the logistical piece, which is really important. I'm not sure which group that was.
Thanks, Brenda. That's great. Right. It's thinking, right? It's thinking through, these are very different capacities too, right? So you're thinking about what's needed in terms of measuring your outcomes, but not just measuring them, actually bringing those back to the group, facilitating people's understanding, right? Building situational awareness of what really is happening so that people can act, creating those spaces, right? That really are inclusive, right? That is this mechanism of shared communication, even if people can't attend to a particular meeting, are people still included in the process, right? These are capacities, right? This is, and I like this, the idea of thinking about what is the infrastructure you need, right? What are all the structures that you need to actually move and handle these things? It's different than just saying, here, we're going to implement the plan. It's what's the structure that we need to actually support the collaborative process, right? So this is the process. Are there other comments, other groups people want to share?
I'm not sure if you mentioned group 8, but they had put patience, open-mindedness, making sure the right people are involved, helping people process the change. I really like that because I do think that that is one of the big hurdles that we can see is like people being resistant to the change. So helping people process that and changing priorities when needed. So I love the flexibility that is brought up in those comments.
All right, excellent. All right. So now I want us to keep all that in mind, right? So I'm going to move to this, particularly the capacity assessment tool, but I didn't want to just start like, here's a tool, here, assess your capacities, because you all actually recognize and know a lot of what needs to actually be put into place and manage towards to truly be successful in a collaborative endeavor. So I don't want to just skip over and say, we have this or we don't have it. It's like, we know what we're trying to build together. Have we set the conditions that enable us to move and to work in these ways, right? But in particular, the capacity assessment tool. So if I could go to sharing the Jamboard piece here, I wanted this one to keep it in mind, and we'll send this out so you all can have this to keep in mind. The beauty about every system is perfectly designed to get the results that it gets is if you aren't getting the results, then you can change that system design. That's what I really even liked in Lydia reiterating group 8, right? Like helping manage the change and actually change your priorities if it's not working, right? So how do we actually recognize that? So for the second slide, I'll call it a slide on the Jamboard, right? So the goal of the goal of this session is to assist you in using the capacity assessment tool. What we're hoping, of course, is that it's not the tool, the link that's sent out, it's not a check the box kind of exercise, right? But what it will actually be is a way for you to deepen a conversation collectively to recognize what is it that we need to be managing to put into place to enable us to work together collectively to achieve our ultimate goal, right? The ultimate goal is going to surpass any particular plan you plan at the moment. You're going to do your best thinking at the moment, but when it comes to implementing, things are going to be changing, right? So what have we built as a foundation to truly achieve our goals, right? So the tool, that title, 4E agencies, other public organizations, community partners, you're encouraged to actually complete the tool in order to determine your motivation for change and readiness for embarking upon comprehensive prevention planning, right? So what the tool has encompassed is an idea to reflect on these 4 key domains, right? The motivation for change, your provider capacity and capability, your system capacity and capability / your infrastructure, and the policy supports. So the idea of this is to have a collective understanding of what are your strengths in this area, in these areas, what might be areas to develop or challenges that you see, and then possible strategies for actually attending to those. The tool, again, it's a tool. It's intended to facilitate conversations, to build buy-in, right? And really consider the technical assessment supports that you would need or may need to actually achieve your goals, right? So by filling this out, right, so you'll do that assessment, you'll take a look at your strengths, the areas that you have, you'll use this as a guided way to create and develop and inform both CDSS and the strategies TA team what kind of technical assistance you might require, both in terms of truly completing the plan, right? That's the first area. You know, do you have all the elements? Have you the ability to actually create a plan with all of the intended elements? And then moving yourselves into implementation, right? So if we could go, so that's the goal and intention of the plan. I put this slide here, right, as a way to say you all are already organizing yourselves, right, in a variety of ways in order to identify and coalesce and bring together all of the elements needed for the comprehensive prevention plan, right? So thinking about who you have all brought together, who's actually contributing to developing those plans. These are the folks that you want to introduce and have give you feedback in terms of where do they actually feel they are or feel that the group is at in terms of its capacities. All right, I'll give everybody a sec. All right, so if we could go. So here's where we're going to do another breakout. Right. So again, as I said, the assessment tool is organized in these 4 key areas. I will call them key domains, right? So it's motivation for change, the provider capacity and capability, right? The system capacity and infrastructure, and policy supports. So before you actually go to the tool, my suggestion would be to actually have as part of your group or your collaborative body or a smaller kind of portion, a work group of that, think for yourselves, right, your particular context and what do these mean, right? So what is motivation for change? What does that look like in your county and in your group? And what are the key elements that you're looking for? Right, that would actually demonstrate to you that you actually have these capacities, or this is the capacity and how you want to have it built, right? So I wanted to actually do this in a small group. We're just going to break out into 4 groups. So you'll be with folks from all over the state, and you're going to be using Zoom. I'll let Lydia do an example of how Zoom actually works. And I want you to just put in, what does this look like? If we're saying motivation for change is a capacity, well, what are the behaviors and actions that would let you know that you actually have motivation for change, right? So that's what we're going to be doing in that exercise for each of these. So Lydia, do you want to just go over the mechanics of Zoom?
Jamboard, you mean? Jamboard?
Yeah, Jamboard, sorry.
All
We're
the
already
different-
into it. We already did it.
all the different acronyms and names.
Right.
So for those of you who are not familiar with Jamboard, it's pretty simple to use, but I will point out some of the features and how to use them for you. If you're unable to do it, if there's someone in the room that is more experienced and wants to share their screen with the Jamboard so everyone can kind of see how things look, I would suggest, actually highly suggest that as well. So on the left is your toolbar, and I would just suggest using the sticky notes to make it simple if this is your first time using Jamboard. So you'll just hit this, it'll say sticky note, and you can pick the different colors, and you can just put, whatever you'd like in there. When you're done with the sticky, you're going to save it. If you're done using the stickies, you just press cancel and it goes away, and you can move it around. You can also make it bigger or smaller. And if you wanted to delete it, you just hit the 3 little circles here and you can delete that. If you want to duplicate it, you can do that as well. If you want to get really creative, there is a pen that's an eraser. There's also, you can also add images. The stickies are probably the easiest things to work if it's your first time. So that's probably what you'll be using. If you need any assistance, we'll be popping into the rooms to help you with that if you need it. But again, if there's someone who is assigned to the room, if you could please share your screen, we'd really appreciate that. And then if folks have trouble, we can pop in there. Also, please pay attention to your group number. We have the group numbers that are up here in the top left-hand corner, and you will work on that page and that page only because we want to make sure that each group has their own page to work on that. If you see on the very top, you'll see the little arrows on the top that you can hit and it'll change the page. So you'll be able to find your group number like that. And again, if you have questions, please let us know. We are here to help you. We'll also just pop into the rooms to make sure everyone is settled and set.
Are there any questions before we go into breakout around anything that we just discussed or?
I have a quick question just for us folks on the back end. So Pat and Lydia, we're breaking into 4 groups or we're doing 4 people per group?
4 groups.
4 groups, large groups. Thank you.
Yeah, this will be in a larger group session to hopefully be able to engage across counties, right? It'll enable you to work with others and think about this, gathering different perspectives.
I just had a quick, in the chat, somebody had asked, oh, Guadalupe, where can we find these documents? I didn't know if she was referring to the capacity assessment. So I didn't know if we could drop that in the chat if somebody has access.
We actually will be giving that out for sure.
Okay.
That has already been sent out to everyone, of course, but we actually will have the link at the end as well for folks to go back in. Right. And we'll talk through a little bit. Once we go through this, we'll talk through a little bit about this process of how to think about this. Because my goal is to get you to think about how might we bring this forward to truly have a collective exercise and a collective understanding of what do we need to prioritize and what do we need to be working on to build the capacity to achieve our goals, right? Oh, thanks, Jagdish. There we go. Perfect. And you'll get both the PowerPoint and the Jamboard after we're finished to allow you to play with this more, right? And to consider this more and possibly even use like the Jamboard with your group and a session for your group. Any other quick questions before we go into the breakout?
In how many minutes do we have for the breakout?
So for this breakout session, we have 30 minutes.
30 minutes.
All right, thank you.
Okay. The Jamboard link is in the chat again for anyone who didn't get it the first time. So we went ahead and dropped that in. So that is there. So you can click on that and you can start adding once you find out which group number you are. So when you're assigned to your group number, just if you could please pay attention to which number you are so that you can go to the right page on the Jamboard. So we'll go ahead and open
someone in
those
the
up.
group. Well, no.
Yeah.
Here we go.
I'm open now.
All right.
Great.
And I just wanted to, this is the interpreter here. Hello, I just wanted to make sure again that you don't need us for the breakout room. Is that correct?
Right, that's correct. Thank you.
Thank you. So it's at 11:38. We'll be back in the main room. 11:30.
Mm-hmm.
Yep, right around there.
Yeah.
So you try safe for 11:40.
Yeah.
11:40. Okay.
Yeah.
Thank you very much.
Yeah, thank you.
No problem.
So we're doing great on time.
Do you need me in a breakout? Or do we have a strategies or a support person in each one?
It looks like we do.
Okay.
Oh, this definitely looks like a better mix, right?
I think there's nobody in room 2 from our team.
Let's see.
Oh, okay.
I'm assigned to 4. Should I go ahead and hop in?
You're in 4. Is there anybody else in 4 right now?
Yeah, Lola. Do you want me to put you in 2, Serena?
Sure.
Yeah, that's good.
That's a good idea.
And then I think,
Also group 3, maybe.
yeah, group 3.
Let's see who we have.
So it looks like Troy's in 1, Serena's in 2, there's no one in 3. And then Lola's in 4. Where's
can go-
Barb? I think,
Barb is
well,
also in 4.
yeah, I wonder if we can.
Move Barb or Lola, one of them. I don't know, like,
I
or
know.
I can join 3 as well. It's whatever works.
Yeah, maybe because I'm afraid to pull her out because it's
I
kind
know
of.
it might be talking. But yeah, you can put me in,
And you're like-
3. That's fine. I'll go to 3 and support there.
Okay, I think you should. Well, let's see. I'll put you in 3. So I'll just do 10:40, Pat. Is that okay? And then it gives a little bit more time for the debrief. It sounds like and then if they had questions too. So it'll give you 15 minutes versus the 10. Do you think that's okay?
It'll allow us to talk through kind of a process, a facilitated process to consider. Sorry, I did. Welcome back, everybody. All right. I think everybody is back. All right. So if we could show the Jamboard. If we can just take a moment, oops, flip back a little bit. Oops, forward. How was this experience for folks? Do folks want to share some new perspectives or some of the conversation that you had, right? The approach maybe that you even took to identifying what did these key domains mean to you? How did they show up in the work, right? How would you know you would have capacity for motivation for change? Or any of those folks want to talk about?
And you can also use the chat and we
Yep.
will read those comments if you feel shy.
Absolutely.
Since this was our group 1, I'll jump in. Although we put a lot of things up there, our conversation began to concentrate on a couple of areas. One was data, and the other was how do we get this lived expertise to the table? How do we treat them right? And how do we keep them there? So a few folks highlighted that because we had a varying groups as far as where they are on the continuum. Folks who've been in it since San Diego, so coming up on 3 years, and folks who are just starting. And the just starting folks were like, hey, what did you do to start? And it was interesting because that's where the data piece came up. How we had to substantiate the story that we already knew by collecting the data, right? Pulling the data together, making sure that data made sense to us, and then utilizing it to tell the story to the folks that we wanted to have buy it, right? So that data is super important. I often tell folks data is as simple as, if you're a foster care social worker and you have a family who argues 10 times a week and you get it down to 2 times a week, what did you do? That's data, right? So using data in varying forms, and then the whole conversation of lived experience, right? How do we get them to the table? I continuously quote Junius that we do a lot of informing of people of what's going to happen, but not a lot of empowering of people, right? We inform them, hey, do you think this program will work for this neighborhood? They say yes, and we move on. That's not lived experience at the table, right? So we had a conversation about how to do that, talked a little bit about Junius's toolkit and the data playbook, things like that, to assist this process with not only bringing to the table, but making them feel comfortable there and gaining their trust, and so that they can tell their stories. Because eventually they're going to tell us something that we did wrong, we the system, and we have to be prepared for that and be prepared to act on it. So that was our, if I could give 2 big highlights from our group.
Nice, nice. No, thanks for sharing that, Troy. Right, if we could even flip to the next one, because people came up with some common themes, but some different ways to express that. And I've done this with a couple of groups before getting people into really filling out the detailed nature of the assessment tool, because in the conversation, it begins to highlight the values, right, of your particular county and collaborative and what you want to espouse in this work, right? And even begin to highlight the priorities with which you want to attend, right? If you look at all of the capacities that they're laid out, you have 4 different areas, but underneath those, there's a good 25 different ways to kind of think about. And taking on all 25 at once means nothing's prioritized, right? And it's almost like spreading yourselves too thin. So thinking about the way you begin to facilitate a dialogue about capacities is critical, right? And then it becomes context driven for you and for your county. So I just wanted to highlight that, because that's really came out, Troy, in the way that you talked about it, like what was really important to people, what capacities really had meaning, right? What is the value behind it? It isn't enough to say motivation for change. It's, well, who's part of that? Right? And how is that actually being expressed? And would we know it? Have we attended to how we want to work together, not just what we need to get done? So it's a way to kind of differentiate that. Other comments? This is the group 2. Any comments or any thoughts about your conversation or process? Anybody else on group 3? Maybe did a different approach towards this.
Yeah, I can chime in and share a little bit here. I think what we did initially was just took some time to assess where people are in the group that we had, right? Who's in the room, and people are coming into this with all different degrees of knowledge and experience. And so I think, more than anything, we took a step back in our group to say, maybe we need to just see who's here, do a little bit of level setting. So we did show the capacity assessment tool, had some dialogue around that, but I think there was definitely a lot of conversation about the importance of the shared vision, right? In order to have motivation for change, we probably all need to be, committed to the same North Star, to go through that process of having a common aim. And within that process, there is congealing of group members, there's relationship building that happens, right? And so a big part of our discussion, at least on the front end, and group members, please chime in if I miss anything here, but that front end piece was around that. We talked a bit about some of the challenges as well, right, and concerns that people had around, having enough staff, right, that have licensed clinicians based on the evidence-based practices and based on the historical challenges of hiring people right now with those backgrounds. So yeah, group, anything else? I know I'm covering that very, very quickly. Anything else you might add?
No, I think that's really an important aspect of this. In doing this, I've done this with a couple county specific groups. The same actually occurs. You might have been actually meeting together for a while, but it doesn't mean everybody was there from beginning until you where you are now, right? So if I'll show you in a couple of slides, just the way that we discussed it. And people came back and said, well, motivation for change, have we agreed upon a change? I'm really new to this. I don't know what we're even agreed to, right? So a lot of times with these assessments, it's really important to have a conversation, but what does this actually mean to your group? And that can depend how long someone's been involved, the role that they have. So the whole idea of the assessment tool isn't to have this perfect rating scale, it's to build collective awareness, right? And to build that kind of collective situational awareness to say, what is the values that we have that we do need to focus on? What are the capacities that we feel are priorities and critical? One, to get the plan done, right? Because that's very time limited, very specific. It lays out your roadmap. But more importantly, how we then continue to organize ourselves in order to actually implement and complete the plan. Right. So I would think about this assessment tools help you get organized, organizing your collaborative, identify maybe some key priority areas to ask for support and technical assistance in order to set yourselves in the best place to actually move into implementation. So group 4, any comments, suggestions, anything you want to add? Anything that might have been different in your process or what you came up with?
I could just jump in and hopefully the folks in the group will jump in as well. Most of the folks in my group were new to the process, so that would, that informed some of this, but you can see that very similar to the other groups in terms of what are some of the what are the indicators of whether or not you've addressed this area. So I think that's one of the main things. And I think, policy supports is an area of struggle, because that's a hard one to, you might have many great ideas. For example, you might want to have a data sharing system where families can have their information inputted into like a Unite Us type project, and then they don't have to continually, apply for services. But that creates a lot of policy needs in terms of information sharing. So that was one area that we did talk about. And then tracking services and tracking outcomes and how to process referrals. So very specific. And then also clarifying roles under system capacity and capability. That there's a lot of initiatives being implemented right now, and people are, it's confusing, CalAIM and on, and FFPS, FFPSA, SB 2083. So all these different initiatives are underway, along with all the ARPA funding that came down. So, talking about bringing fiscal folks to the table. And some of the counties already had that relationship, which is great. And then of course the workforce issue, which is overwhelming for all of us. Now we have the money, but we don't have the workforce.
Yeah. Well, and that does help you think about, and that's why I actually even put that iceberg in place, because some of these things you actually have to react to, right? The workforce, right? In many ways, adding a workforce, right? And just feeling that is reacting to the moment, right? But you do need to attend to that to enable you to go deeper in terms of other points of leverage. But there may be other things that can happen at that point. But that's why I put that iceberg there, because you don't want all your strategies to be very reactive. You want to set your system up and think about building your capacities to go deeper. Right. And that would think that's more about how are you organizing yourself for the long term? What are some of those longer term skills, capacities, structures, and processes that you will need over time in order to truly fulfill a change in the system? Right. Because if we only change the elements and add more elements, but we're not changing the behavior, right, of the overall system, we're going to get very limited impact, very limited change, right, from the way that the system is currently operating. If that makes sense. So if we could go to the next slide. So what I outlined here, like this is what the capacity assessment tool has underneath each of these areas. So it's asking you to say, do you have leadership buy-in? Do you have stakeholder buy-in? That's what is meant by the motivation for change. What I've found most helpful is to have that deeper dialogue, right? About what is the change that you're asking? Buy into what? What is do you have an agreed upon goal that people actually like saying, yes, we're committed to these things. So it allows you a little bit more nuance to know how you want to attend to working on these things within your county. I just feel it's a helpful way. The process for the assessment can be done in a couple of ways, right? Because only one assessment goes in, right, online and with the link to it. Only one assessment gets filled out, which is that to build out that summary, to build out that technical assistance request. So you can do a facilitative collective sense-making process that then would enable you to actually have yourself, have an individual fill it out and submit it on behalf of the whole, because only one goes in. So we're suggesting you think about what's in the best interest of your county, right? What is the best way to think about, are we using this as a tool to bring, right, a collective together, to have a collective understanding for action, right? Understanding of roles, contributions, what are we trying to achieve together? So that's just what we offer as a suggestion. On the next slide, this is a set of capacities. This is something that I've worked on quite a bit, actually, in my work over the last 20 plus years, right? And these really are researched community collective capacities. So you can see I put in the yellow, right, what the assessment tool is assessing. And then the blue is a different way to think about that fits a little bit with the values that you've all been discussing that came out in your work. And then the orange are the specific actions or tools. These are the practices that you're using to actually demonstrate and you need to attend to have collaboration for a shared vision. So I gave that to you as a reference point, just to think about. It's not critical for you to think about, do I have this for the plan? This is about, am we building and are we thinking about these collective capacities for our ongoing work that will sustain our work as we move towards truly introducing large scale change? And then I'll just share 2 more or 3 more slides, I guess. One of the other things, and we can certainly provide these to you, is a way to actually have an exercise that you work with your group. This is a specific question from the assessment. And then ask people to actually, do they understand the question? How would they actually rate this? And see if people are actually answering the question in the same way. Do they understand the question in the same way? You can see this was one of the feedback from a group trying to do this in a small group. They said, you know, does your team have a collective commitment to change? And then said, well, we don't know if we have a goal. What is the goal, right? What are we to focus on, right? So you can understand it doesn't mean it doesn't exist. It doesn't mean it just hasn't permeated or isn't clearly stated for people to reflect on and respond to in the assessment. So I just want to kind of put those out as ways to think about deepening and using that tool for a deeper purpose, right? For really kind of thinking through a long-term capacity building plan for your collaborative, right? So are there questions or thoughts to this?
I'd like to just say one quick thing, and Patricia, that's in support of what you said earlier. We've already done the capacity assessment tool in Humboldt County. But what we did was bring everybody together, have a bigger conversation about what it was that we were doing, not
Right.
specific to the tools. And then we had them all individually fill it out. So we had community-based organizations, we had government entities, we had the network of family resource centers, we had the tribes. And then we just, added the responses together because it's only, 3 numbers divided by the number of participants. And that was our number for that particular thing. And then we included everybody's comments in the comments section so that everybody had the ability or knew in advance that their response was strictly within their, scope of reference, for lack of a better term. And it really worked out well.
That's an excellent strat. I appreciate that, Cynthia. That's what I mean about making it a collective sense-making exercise, right? And discussing it ahead of time like you did with the groups is critical, because what are you actually intending to do, right? There's no premise before the capacity assessment tool that says, we're building these capacities for what purpose, right? What do we actually are attending and what do we want to accomplish? And then where do we think we are along that pathway? So I really appreciate you sharing that. That's a great process. Other comments, feedback? Are folks already completed it? I'll take that as a maybe.
Now we have about 1 more minute left.
All right, thanks, Milton, right? And your strategies TA team is available to help you think about what is a process that might work for you, right? And how to support you in thinking about how would we do this? How do we actually get the most from this and to have this be most meaningful as we move our work forward.
Yeah, I see that Lydia just put, we'd love to hear your thoughts about this webinar today. We'd really appreciate your feedback so we can, of course, make this as useful as possible for everybody as we move forward with some of the supports around this tool specifically, and also comprehensive prevention planning. So yes, please take a minute to do the survey. That would be wonderful. And I believe Lola is going to take us home.
Yeah, just want to thank you all for your time today and your thoughtful input. It's incredibly helpful. And just wanted to reiterate, I did put the link to the FFPSA inbox there. That is the way to access technical assistance at this moment in time. And really this whole webinar and the whole concept of this collective sense-making tool, the capacity assessment, is really to help the Department of Social Services to determine what TA is needed, where, and how to mobilize those TA partners that we have. So it is an important aspect of the work. And if you need help filling it out, again, there's that email inbox that you can go to. Thanks, everyone.
And just as a reminder, we will send a follow-up email with links that have been shared in this webinar, as well as the PowerPoint and the link to the Jamboard. We'll probably also include a PDF copy of all of the different boards and slides so that you can have that easily accessible. And again, please follow us on Facebook, LinkedIn, and our YouTube. This will be posted on our YouTube probably in the next few days. So take a look at that if you want to share that with other folks. We'll include the direct link to that as well. So thank you again for spending your morning with us. We appreciate your time. We know how busy everyone is, and we hope to see you at our next event. So please check our website for future events around the comprehensive prevention planning process. Take care, everyone.